All right. Good afternoon, everyone, and welcome. And thank you for being with us. We're going to go ahead and prepare to get started so we can keep on time today. And our fantastic CAYL staffer, Amanda, here will be pulling up our slideshow. Um, Welcome again to the CAYL Catalyst webinar series. My name is Sarah Gilliam, and I'm the editor-in-chief of Exchange Magazine. It is an absolute delight to be here. I'm so grateful that CAYL staff asked me to participate in this important conversation. I also have the privilege and the pleasure of serving on the CAYL Board of Directors. So that's kind of my affiliation with this organization. And I must also note that it is frankly unfair to ask absolutely anyone to step into Valora Washington's shoes. But with that said, I'm very happy to stand in for her as host today. Amanda, if you'd go ahead on to the next slide. So who is CAYL? Who are CAYL? CAYL stands for Community Advocates for Young Learners. And I think the most important thing to notice about CAYL is that we really believe in representative leadership and the idea of involving those who are doing the work of early childhood in the decisions that affect them the most. And you can see here on this slide, of course, the other things that we are deeply committed to. We have the vision of a nation where the right to high quality early care and education is embedded in public policy, professional practice, and family engagement. Go ahead, Amanda. So here is our agenda for today. Pretty simple and straightforward. I'm gonna go through just a few introductory slides with you, get you prepared for what to expect from today. Then our fantastic and esteemed panelists will share what they've prepared, and we will close out with a Q&A discussion. Both hopefully we'll have a little bit of time before the end of this session. And then when this hour concludes, we will be sharing a link in the chat to a follow-up Q&A session, an informal chance for you to get questions answered and interact a bit with our panelists. So please be sure to tune in for that once our official hour of this webinar concludes. Just a couple of pieces of housekeeping. As you can see, this meeting is being recorded. We will also be providing closed captioning. If you need to, please click that button at the bottom of your screen. And finally, stay in touch with us in the chat. CAYL staff and I as well will be monitoring that chat to make sure that we're able to bring forward your questions when appropriate, and to make sure we're just on top of any technical difficulties or challenges that you may be experiencing. So please use that chat and know that we will be keeping an eye on what you share in it. We just wanted to mention this fantastic new resource, the New Early Childhood Professional, which is written by two of the three authors, our CAYL staff, Valora Washington and Brenda Gadsden. And you can order this book now on the CAYL website, kayl.org. All right, so let's jump in. As you know, today we're going to look at how COVID-19 has affected our work and, of course, the lives of the children who brought us to this work in the first place. So in particular, our panelists are going to look at the effects of COVID on the ECE workforce. Of course, we know that the added stresses of providing childcare during the pandemic pushed many excellent practitioners out of our field. And then conversely, those who remain standing face a whole slew of added stresses of their own. We're also going to look at the impacts of COVID on children's health and mental health. Dr. Yogman will unpack what we really know about the prevalence of COVID in children. He'll offer a few words about vaccines and vaccine controversies, and then some thoughts on supporting children's mental and physical health in meaningful ways as we move into the quote unquote post-pandemic era. And then finally, we are delighted to have Cecile here to share what she and her colleagues have been experiencing across the last few years. What kinds of behaviors are they seeing as a result from COVID? How has COVID changed parent communications and relationships? And how can educators address the need for balance when it comes to these dueling ideas of catching kids up versus meeting their more complex than ever emotional needs? So the perspective that I'm bringing today is that I'm hearing from our Exchange magazine readers. And so I will admit that I'm here with a few questions of my own today and a few things that I think would be great to talk about. The first is staffing. Hiring and retaining new staff is a critical issue for our Exchange magazine readers. I hear about this weekly. I spoke with a center director a few weeks ago who admitted to me in dismay that she's had to lower her standards for hiring teachers because she simply cannot find applicants who meet her program's qualifications. So what has COVID done to our ECE workforce? And equally importantly, where do we go from here? Additionally, I am hearing from our Exchange readers that they are frankly exhausted from constant adaptations. They have never before, perhaps in their lives, have they been asked to innovate so much and stay on top of policies and procedures. And yet at their core, these educators still feel a deep desire to do right by the children in their care. So in short, we need to better support caregivers. And that support needs to be sustaining, authentic, and genuinely useful. So I hope we can talk a bit today about what that might look like. And finally, we will address the children themselves. What will this generation of young children's lives look like? How have these last 2 to 3 years affected their mental and physical health, as well as their social emotional development and learning? So, easy topics to cover in 1 hour, right? Just one final reminder before I introduce our speakers that we will continue this discussion. So don't fret if we don't get to everything in this first hour. But with that, I would be thrilled to introduce our guest speakers. First up, Dr. Jacqueline Jones has been a teacher, researcher, and policymaker, which I believe in the world of ECE makes her a triple threat. She is currently the president and CEO of the Foundation for Child Development. And during the first term of the Obama administration, Dr. Jones served as senior advisor on early learning to Secretary of Education Arne Duncan, and also as the country's first Deputy Assistant Secretary for Policy and Early Learning in the US Department of Education. Boom! Dr. Jones brings to today's event her perspectives on COVID's effects on the workforce and the economy. Next up, I would share Dr. Yogman's full bio, but again, we only have an hour here together today. So in brief, please let me introduce Dr. Michael Yogman, who is an assistant professor of pediatrics at both Harvard Medical School and Cambridge Hospital. He is a longtime community advocate and friend of CAYL leadership. He has served in roles on the board of the Boston Children's Museum and as chair of the Massachusetts American Academy of Pediatrics Child Mental Health Task Force. He's also immediate past chair of the American Academy of Pediatrics Committee on the Psychosocial Aspects of Child and Family Health. And today, he is our go-to panelist for updates on how COVID has affected children's development, health, and mental health. And then finally, Cécile Toussaint has worn many hats in her career, including those of educator, licensed and NACCE accredited center director, and consultant. Her passion is to improve the lives of young children and their families, and she is heavily involved in advocacy at the local, state, and federal levels. So as you can see, we are in excellent hands with Cécile, who is really here to represent that practitioner voice, which we at CAYL believe is always an important perspective to share in these webinars. So as we move ahead, I will ask each speaker to introduce the next guest when they conclude their remarks. And with that, Dr. Jones, I will turn things over to you.
And thank you, Sarah. One correction, I am the former president and CEO of the wonderful Foundation for Child Development. I want to express my thanks to the CAYL Institute for providing this platform to discuss important issues in early care and education, and for inviting me to participate. As some of you may know, I've spent a good deal of time thinking about ways to support the early care and education workforce so that they might better support young children and the families with whom they work. As a panel, we've been asked to reflect on the impacts of COVID on the field, and I'll begin our conversation with a few thoughts about what the research is telling us about the impact of COVID on the workforce, and then I'll move on to some emerging evidence around young children's academic achievement. And we plan to address some policy recommendations when all the panelists come together at the end of the individual presentations. Sounds like a very packed hour. I just want to start being really clear that COVID itself did not create some of the issues we'll be discussing. Rather, our response to the pandemic forced the existing inequities and systemic dysfunctions to the forefront. So what happened to the early care and education workforce? Consisting primarily or approximately 40% of women of color, this traditionally undervalued and underpaid group became essential workers. And that means they were required to go to work in a pandemic when others could stay safely at home. Programs struggled, and even with emergency government funding, some programs found it difficult to access this financial support. Some programs closed, or when they remained open, workers faced additional demands. While Head Start and other publicly funded programs were a bit more stable, it's not surprising that across the field, there were high levels of emotional stress. And researchers have reported concerns around workplace closures and job changes, contracting COVID, their own risks for severe long COVID, the use of social distancing practices with young children, and food and financial insecurity. So folks were leaving their positions, jobs they loved. And data indicate that over 150,000 childcare jobs were lost during the pandemic. And as Sarah has mentioned, staffing is still not back to pre-pandemic levels. Reporting on a survey of New Jersey's childcare employees, the group Advocates for Children of New Jersey found that those who were laid off were often able to access additional $600 a week through unemployment funding provided by the CARES Act, that's the Coronavirus Aid, Relief, and Economic Security Act. This was more than regular unemployment benefits for minimum wage employees. However, AC&J also reported that those same funds made it difficult to bring staff back to work. Workers were making more money on unemployment than if they were working. So why take the health risk? It's a serious issue. The Center for the Study of Childcare and Employment surveyed a sample of California workforce employees and reported that center-based programs experienced more staffing challenges, changes in program operations, and reduced attendance than family childcare providers. More than half of center directors had increased staffing costs, and a good 87% of centers were forced to make staffing changes such as layoffs, furloughs, and reduced hours. They reported about a 36% job turnover among teaching staff, with about 58% of those among assistant teachers and 32% among teachers. This is an extraordinary level of disruption. Now, family childcare providers had a difficult time. They work in their own homes and they face the greatest economic challenges. 64% remained open throughout the pandemic, higher than centers, but this was largely because they did not have the financial resources to survive even a temporary closure. But what we see from data is that regardless of center funding type, 95% of all centers indicated that finding teaching staff with the desired qualifications was a challenge. And again, Sarah made reference to this. And 78% of centers reported difficulty finding staff due to the low compensation that they were offering. Childcare employment is still a little over 8% below what it was in February of 2020. I think we should be very grateful to researchers who saw a potential crisis and acted immediately to try to understand what was happening. The Center for the Study of Childcare Employment in Berkeley has been at the forefront of research and advocacy for the workforce since 1999, and they followed the impact of COVID. Dr. Walter Gilliam at the Yale Child Study Center surveyed over 55,000 childcare providers to get a sense of how they were doing and what procedures were being put in place. Groups such as the Urban Institute, the Center for American Progress, Childcare Aware, worked to push data out as quickly as possible And philanthropy also engaged in some rapid response funding that helps support this work. But let's be clear again. COVID simply exacerbated an existing set of flawed conditions. Pre-COVID, we knew that the United States did not have a comprehensive and coherent policy for the care and education of young children. We knew that early care and education rested on a patchwork of independent funding streams, and that the business model for childcare was so broken that in some cases, it could only be sustained by paying poverty level wages. And we knew that child poverty in the United States was at unacceptable levels. A very readable overview of early care and education conditions in the US has been written by Anya Kamenetz, an education reporter for National Public Radio. Her book, entitled The Stolen Year: How COVID Changed Children's Lives and Where We Go Now, provides some insight into the systemic failures that we face and cites some pretty good research. So now if we think about the children, while COVID affected the workforce, children were also affected. There's been much discussion around learning loss. How can we help children catch up, make sure they're resilient and supported? But some hard data is needed and is necessary to understand what happens and to which children. So kudos to the National Center for Education Statistics for conducting special administrations of the National Assessment of Educational Progress, known as NAEP. The long-term trend reading and math assessments were conducted in 2020 and again in 2022. These NAEP data are intended to help understand reading and math achievement during the COVID pandemic, and the data are compelling. I'll focus on 9-year-olds, children who were 9 in 2020 and children who were 9 in 2022, so they were 7 at the beginning of the pandemic. On average, in reading, average scores for 9-year-old students in 2022 declined 5 points in reading. This is the largest decline in reading on NAEP since 1990. That's the biggest decline in 30 years. In mathematics, scores for 9-year-olds declined 7 points, and this was the first decline in math scores in NAEP's history. However, average never tells the complete story. There is nuance, and that nuance is important. We look at higher performing students, and we'll define them as students in the 75th percentile, and lower performing students in the 25th percentile. We see some differences. Lower performing students had greater decreases in scores. Scores declined in mathematics for white, Black, and Hispanic students at the 75th percentile. However, no significant score changes were seen in reading across high-performing 75th percentile students across racial and ethnic groups. So regardless of racial and ethnic groups, if you were high-performing in that 75th percentile, there were not significant changes. The assessment also sought to understand the conditions that might factor into these scores. So students were asked whether or not they had access to a computer all the time. For high-performing students, again, those are students in that 75th percentile, 83% of them said yes, they had access to computers all the time. Those low-performing students, 25th percentile, 61% of them said they had access. When asked if you had a teacher available 1 to 2 times a week, 60% of high-performing students said yes. 39% of low-performing students said no, were able to say yes, pardon me. If they were asked, and when they were asked, was it more difficult to learn remotely? High-performing students, 28% of them said it was more difficult. 42% of low-performing students said it was more difficult to learn remotely. So you see these differences in where they are. This NAEP report, I want you to take a look at it. It's a terrific resource because you can play with the charts on the web page and manipulate the data to see how scores played out across school locations, gender, race, ethnicity, English learners, students with disabilities. I encourage you to take a deeper look at this work. I'm reminded of the constant refrain during the pandemic that we were all in the same boat. However, someone who's anonymous to me made an important distinction. We were all in the same storm. Some were in boats, some were in yachts, and some were drowning. These inequities continue to be played out across the country. This is a very quick look at some of the research on the impact of the pandemic on the workforce and young children. And I will now turn the discussion over to Dr. Michael Yachman.
Well, thank you so much, Jacqueline. I think that, although I'm going to talk about the health and mental health impacts of COVID, I think your comments about the disparities in its effect and the inequity that had been present before was just so accentuated during this COVID pandemic. And that's a kind of a shocking embarrassment, and it speaks to the need for dramatic changes in policy. So I want to thank the CAYL Institute for bringing us together. I want to talk a bit about I'll focus on health impacts first and talk a little bit about the epidemiology of COVID in young children. But I think I want to just emphasize the fact that there's a myth that kids don't get very sick from COVID, and that it's more a tragedy for people that are elderly or immunocompromised. And although there's some truth to that, I want to emphasize that there's a lot we don't know about the long-term impact of COVID in children, and there are children that are really severely infected by COVID, although it's smaller in number and percentage than older adults. So to begin, 1 in 6 children in the United States have been infected with COVID at this point, about over 18% of all children. We're talking about roughly 14 million children under age 18, 6.8 million alone in 2022. Over 100,000 children have required hospitalization. So you don't want to be the one exception to the rule that it's a mild illness for your child. There have been 1,500 deaths. 400 of those deaths are in children under age 5. Globally, 17,000 children have died, and 50% of those are under age 10. So before we are too cavalier about the effect of COVID in children, I want to emphasize risk factors include asthma, diabetes, obesity, sickle cell disease. But some of the things that give us pause about the impact of COVID is something that we discovered about a year into the pandemic called multi-system inflammatory syndrome in children. It consists of fever and inflammation of 2 organ systems about 3 to 6 weeks after what may seem to be quite a mild illness, more common in children ages 6 to 10. We're talking now about approximately 8,000 children, 66 of which have died, mortality rate of 0.8%. So not to be toyed with. Secondly, the complication we worry a great deal about is long COVID, which we hear a lot about in adults, but in fact, 1 in 4 children with COVID can develop symptoms of long COVID. Again, data is still being collected and not as robust as we like, but we're talking about children that can develop a set of symptoms that last weeks up to needing to weeks to months. The symptoms need to last at least 12 weeks to meet the definition of long COVID, but it involves abnormalities of sleep, fatigue, headache, problems concentrating, joint pain, muscle aches, and even new onset diabetes mellitus. In the UK, 120,000 children have been diagnosed with long COVID, and 26,000 children have had symptoms for longer than 6 months. One of the I want to talk about the role of vaccines, because not only do vaccines prevent serious illness in children, but they also protect all of the citizens who are particularly vulnerable. Now, as we've learned, although the vaccines don't necessarily prevent infection, they have been remarkably effective in preventing serious illness and hospitalizations. And that's really where our focus should be. In fact, we now have data on 2 doses of the Pfizer vaccine prevents this, decreases the risk of multi-system inflammatory syndrome in children by 91% in those ages 12 to 18. So the vaccines are safe. They've been administered to well over 27 million children over age 5. The side effects are relatively mild: fatigue, a little headache, a little muscle pain, a little nausea, and a little fever, most of which are resolved in 24 hours. So the concern we have is about the hesitancy of parents from diverse groups to be reluctant to immunize their children. And it's been an uphill battle. The uptake of vaccines is not anywhere near what we'd like it to be, given the safety and the efficacy in preventing the kind of severe complications. Although rare, you don't want it to happen to your child. And you don't want it to be spread to teachers in childcare settings who may be vulnerable and at risk. And many of the centers that I consult to have staff with diabetes or other risk factors that make them more vulnerable. One thing we haven't talked about enough that's going to be a huge issue going forward, and particularly around the equity issue, over 200,000 children have lost a caregiver and are either orphaned or in some kind of substitute caregiving. And we need to address it, part of the broader issue of the mental health impact of COVID on children. But we need to address the kind of grief and sense of loss that those children are experiencing. Want to just say another word about vaccines, that one of the critical things about vaccines that we want to emphasize is how important it is to keep schools open and to mitigate the learning loss that Jacqueline has described. Allowing the kids to socialize with each other by decreasing the risk of illness thanks to these vaccines. And as I said, it helps protect the caregivers who may be in a higher risk category. We now know for the younger children that 2 doses of the Moderna vaccine, a quarter of the size of the adult dose given over the course of 1 month, is protective, and the Pfizer vaccine, 3 doses, 1/10 of the adult dose over 11 weeks is protective. We want to talk a bit about the mental health impact. We are seeing an enormous uptick in mental health problems in children across the age group. Anxiety, depression, eating disorders, suicidality, that has swamped the workforce's ability to provide care for these children. It has more of a devastating impact on children with disabilities, many of whom have been deprived of their special education services when schools were closed. There's a lot of controversy about child abuse. The data is quite confounded and difficult to sort out. There's studies that suggest that there's been less abuse, that somehow parents have been able to be resilient. But I think there are real problems with reporting, since kids were often not in school and not being seen in person at pediatric offices. I want to emphasize the role, as we talk about learning loss, I want to emphasize the role of social-emotional learning and of remediation that encompasses socio-emotional support, and not just drilling kids on multiplication tables, on math, and on phonics. I'm thrilled that Roberta Golenkoff is in the audience, who's done marvelous work on the importance of play and playful learning, which encompasses both facilitates and mitigates the learning loss, but also protects the kind of socio-emotional learning that is really such a critical part of for kids. So I think one of the most troublesome aspects of the controversies that have arisen about these really marvelous mRNA vaccines is that for reasons that are quite challenging, people across the board, but people that perhaps have not been treated well by a healthcare system in the past, are very reluctant to vaccinate their children. And the real concern here is whether it spawned a whole new surge in an anti-vaccine movement that may have dire consequences for the future. So for the first time now, we're seeing cases of polio in New York State. And we're seeing vaccine rates that diminished when kids weren't seen in person during the early days of the COVID pandemic, but still the catch-up rate for preventing epidemics of measles, polio, and the vaccines that the illnesses that we had done very well by preventing with vaccines are now at risk for reemerging. And I think we need to really pay attention to that and really push back about some scientific misconceptions about the risks of vaccines. So just to summarize on what we can do to protect children, to keep schools open, to support their learning, and to support their caregivers, I would put enhancing our vaccine rate at the top of the list. I would encourage, whenever possible, to keep the option of wearing masks. As COVID is now surging again this fall, keeping the option of wearing masks in indoor spaces with poor ventilation. I don't think we have any convincing data that children or adults wearing masks impairs children's development. There have been some concerns about that, but I don't think we have any hard data. Kids can be remarkably resilient at reading emotional expressions from eyes and foreheads and areas that may not be masked and covered. We want as much as possible to keep kids in small groups, to encourage them to be outside, to travel in safe ways, and to, as I said, minimize large groups inside and promote better ventilation. So why don't I stop there, and delighted to introduce our next speaker, Cécile Toussignan, who will talk about what it's like to be in direct online direct work with children.
Well, thank you, Dr. Yeogman, and you've only left us all with more questions and more questions. I needed to say that at the beginning of COVID, I was working as a coach with other coaches on a building resilience program funded by the Office of out of the Office of Child Development in Boston. And we were working in collaboration with UMass Memorial Hospital. And there you go. We were denied entrance then into classrooms. We were providing data and doing studies and emphasizing practices for teachers, but could no longer enter the classroom. That pilot program was supposed to end and did end on June 30th. However, it's significant that we were already dealing with problems prior to COVID. So generally speaking, I am no longer a practitioner, by the way, but I have the advantage of being able to visit childcare centers, and I'm in a collective group of directors in the Montechusett area. So I'm able to get input from them. And now, of course, I can enter classrooms. So basically, let me just refer to some of my notes. This is an umbrella statement, but lack of social skills is what teachers and educators are reporting. Now, we have to admit that when we bring children into a program, we don't expect them to have social skills. This is where they've come to learn how to interact with their peers, how to be involved in group activities, how to wait their turn. Well, but this is exaggerated now a great deal. We see children at drop off are crying when the parents leave. We see children learned helplessness, having been at home with their parents who are working from home, who could not put their jacket on by themselves or were struggling to do that. Parents who were multitasking by being on the job and by doing childcare because their providers were closed, public schools were closed. So parents just had to quickly do it themselves. So these children, such as zippering jackets, putting on shoes, sweatshirts, and so on, they're crying, standing there, I can't do it. Also having trouble with transitions. Now, let's remember that an educator recognizes that we need to move into transitions with a transition piece. But when we have children, or even one child can disrupt a whole classroom, teachers need to backtrack and reassess the situation. So if we're in the middle of implementing a curriculum activity, for example, and we have a disruption for seemingly no apparent reason, the educators have to kind of pivot and reassess and go back to working with the child on their emotional needs and then providing them with suggestions as to how to deal with a situation, such as sharing. Housekeeping corner is always very popular, but a child who's engrossed in their activity in that area, and another child enters their space, or they claim as their space, there's going to be some crying and fighting and grabbing and not taking turns. Also, oral fixations. Is it snack time yet? Is it lunchtime yet? That sense of unpredictability, which is what children experienced through COVID, they still have that sense of anxiety that that they need to cope with, and so then the educators need to deal with that. Parents are on the defensive. They're looking for academics and concerned about learning loss, and teachers are feeling defensive, questioning what the director is asking of them. Add to that a classroom has one child who was tested positive for COVID. So now you do the deep cleaning and you alter again your path forward that you had planned. It all increases the stress level. And so I even question how much that impacts the child in the classroom. And then we have parents stressing, de-stressing from work at having had to work at home, dropping off their children. And then we have educators who are trying to communicate something to the parent, and the parent just has to shuffle it off and move along because they're going to brick and mortar jobs and they don't want to be late, and they just are struggling to find time, even just to have a conversation with the teachers. It's been very challenging. So the biggest challenge, according to a study at Stanford University, they do a rapid surveys for the families who worked at home with children at home during the pandemic. There were 3 top challenges reported by all caregivers, and that was caregivers are struggling to balance work and childcare. They're struggling to with the well-being and emotional distress, and number 3, trying to find stable employment. Now, part of that emotional distress due to isolation, they couldn't connect with friends, they couldn't connect with family. So another report that I received was from a public school professional staff support person. She's a behavior analyst. She's seeing decreased frustration tolerance and lack of self-regulation skills, more challenging behavior to get their needs met instead of functional communications. And they have a harder time waiting, staying on task, dependency on adult prompting to initiate, to persist and to complete tasks. And some are observed to have a harder time sharing or engaging in reciprocal play. So we need to remember that during the pandemic, screen time was a very helpful caretaker when we have families working from home. So is that also a contributor to the difficulty in children adjusting, readjusting to group settings? Brown University did a study that concluded that there is significantly reduced verbal, motor, and cognitive performance as compared to children born pre-pandemic. The study noted pandemic babies, disrupted educational experiences, isolation, and limited explorative play, and lack of interaction with other children. That's concerning. We, as Dr. Yeoman had mentioned, did masks cause the delay in language development? Well, I think further research is needed there. It's a quick answer, but there are other contributors to that. In a separate study, Columbia University reported pandemic babies scored lower on social and motor screening tests at 6 months. The Canadian researchers report increased risk of developmental delays among 1-year-olds born between April and November 2020, and the link between higher levels of distress experienced by pregnant women during the pandemic and changes in their babies' brains. The studies are awaiting peer review, but there are different studies happening to see what impacted children, their development, their behaviors. And it's forcing teachers to go back to building relationships, which is where we want to be in the first place in the early childhood classroom. So I think I've left you with more questions, and I hope that I've shared the experiences of those participants who have who are working in the classroom post-pandemic, and I think we're ready for group discussion.
Right. Thank you so much. Well, I'm going to invite all of our guests to come on camera and unmute now. First of all, well done, panelists. We are on time. And given that, and given how much you have already shared and presented, I think that is quite impressive. Before we jump into maybe a broader discussion and bring together the different themes that you've all shared, just quickly, Dr. Yogman, from the chat, I want to give you a chance to follow up on what Cecile had mentioned. Is there research on mask wearing and language developmental delays, or any other research that you'd like to share that you've reviewed related to mask wearing?
Yeah, I mean, there are isolated studies, but no clearly replicated conclusion. So that I think the remains to be seen. I think what Cecile ended up on, I really want to emphasize, which is the power. You know, we can look at the downside. Clearly, the pandemic is a horrible experience, and for teachers, for children, and worse for our most disadvantaged families. But I think what Cecile said that gives us some grounds for optimism is the importance of relationships, and the opportunity for recovery that childcare facilities can provide to provide that kind of safe, stable, nurturing relationships that we know can mitigate the stress of the pandemic from lots of research on brain development. So that's where we need to focus our energy now, is on promoting those healthy relationships.
Thank you. Well, I would like to offer kind of a prompt as a jumping off point for the three of you, and then I'm going to get out of the way. To be fair, you've presented a great number of challenges across this conversation today, from vaccine reluctance to learning loss to challenges for our ECE workforce. I'm also aware that there is a strange and small silver lining to these last few years, which are that they are presenting us with an opportunity to reimagine how we do things, how we've always done things, as you mentioned, Cecile, to really reimagine the role of relationships in the classroom and what we're expecting of children and what we're prioritizing. Without a doubt, there are significant policy implications for all of these challenges that have been addressed. And so I'd like to just invite you all to respond to each other's presentations and to kind of take us from this, here are the challenges that our field is facing, into the start of that conversation of what can people who are participating today, what can they be doing in their own lives? How can we be advocates for our field, and where should we go from here?
Well, I have to refer to Dr. Jones's comments about the workforce, how it was already a broken system and how this has just exacerbated it. We're adding to the stress of that programs, classrooms need to close. You cannot get qualified staff. You may have been exposed, to a positive case. And then we have new guidelines, at least in Massachusetts, COVID guidelines that are not as strict as they were prior to COVID. So it's created a lot for a classroom, for the provider, family child care or educator in the classroom, which is why somehow we need to get the message out to them that they can relax their curriculum and just work with the children as though we're back in the 70s when it all began. I don't know. Just simple.
Cecile, I think that if we want to look at a silver lining, it may be that folks have been forced to think about how we fix this and how we do something differently. We were not in great shape pre-COVID. That's very clear. And now we have kids who are coming back to us, and there are all these, the data I presented on NAEP, but they haven't been connecting with other people, and this relationship building
Yes.
is absolutely critical. I guess I'm one of those folks who thinks they'll learn math. We can teach them math. We can teach kids to read. If we really are committed to that, we can do that. But none of this matters without that sense of connection to each other. And I think we've learned that not just for children, but as adults.
Yes.
I mean, I remember the first time I actually went out after being in the house and alone before the vaccine. And I honestly thought, gee, am I not able to really have a conversation in person anymore? What do you do? So I think we've all suffered from that. And I think if we try to focus on what we need to get back connected to each other as whole people again, maybe that is a road in, instead of just getting out the ditto sheets and trying to focus on the math computation. If we can think about the ways in which we can teach children in a way that actually helps them to understand the work, but really connect with each other. Back in the 70s, right? We remember these things. It's not that it's not possible. It's not that it's been done. I think that is possible if we center on children and center on families and center on relationships. I think we have a shot. We got to push that. We've got to push that really hard, and that's not going to be easy. But I think it's worth a shot.
I think it's critical. There are some wonderful comments in the chat about the importance of play to facilitate that kind of connection between children, the relationships. And I think it can, it's not an either or in terms of play versus learning. Kids learn through play, and they have a sense of joy, which we need to encourage and facilitate, because that's also been missing for the last couple of years. So I think we're all of a piece of emphasizing the importance of connection, of mitigating the loneliness that adults and children experience during COVID, of reconnecting, and those are, I think, the lessons and the way forward to get us out of this morass, and to realize that we especially need to focus on the people that were most direly affected, whose parents had to work 2 jobs, who couldn't really provide the kind of nurturing relationship at home that these kids needed when they couldn't go to childcare. That investment is critical.
I guess I'd like to see us think about policy implications for the next situation, pandemic or whatever that comes along, because there will be something else. Clearly, we didn't pass this test very well, but we can build a stronger foundation for childcare. I think it's always been odd to me that we can talk about Head Start and childcare and state-funded pre-K, but they really all need to be connected in the sense of providing high-quality early care and education for young children. So certainly at the federal level, I think there is a huge obligation to have a national perspective on this. What do we want for our children? What do we want for families? And really do the best we can at the federal level to coordinate this system that is not workable. It's just not workable. And I think childcare as a business model would have gone out of the window if we were building cars or airplanes or something. It doesn't work. It requires much more focused and intense federal investment. The National Academies did a very good report, I thought, on financing early care and education. It's going to cost, but it's going to cost a lot more not to do it. And so doing it piecemeal is just crazy. We need to make sure that the next time something happens, that we have centers and family childcare and Head Start and state funded preschool that are fine. They can go on, they can continue and be open and create those places where children can make relationships and families can be supported. But this was, I think this was our best way of looking at what should not happen. If you want negative example, you know, it's just, and the other thing, and Michael, you might have something to say about this, is this notion of, I've thought about this during the pandemic, of science in real time. And it's a hard thing to watch science in real time, because what was true last week may not be true next week.
Yeah.
And that is so hard to communicate. And I think if how we communicate to the public is critical. And I worry about this for research in general, that we are able to help people understand what the research is telling us. And that's hard because there's always nuance, but it's there. And helping people to understand how these things work, that you're constantly looking for new information. And so things change and they need to be prepared for that. I don't think we did a very good job of that either. I think we have lessons to learn again for the next time.
It
I think-
needs me to jump in here. I apologize, Cecile, but don't worry, you're going to have your moment. This is a very rich chat box with a lot of fantastic questions. And so we obviously are not going to get to those in the next 4 minutes, but I do really want to invite folks to join us when we make the jump to the Q&A link at 5 o'clock here Eastern time, and we'll be able to hopefully get to those questions and give you a chance to directly interact with our guests today. But for the moment, I am going to just put a pin in this conversation so that we can wrap up with the final things that CAYL would like us to share with those of you who are here today. Okay, Amanda, please also feel free to jump in if you'd like to speak, but the CAYL fellowships, which are really at the core of CAYL programming, are open to Massachusetts residents, and very enthusiastically, CAYL is accepting applications through October 31st. So if you are located in Massachusetts, have colleagues in Massachusetts, please direct them to the CAYL website. Additionally, CAYL is hiring, having been on the board and worked with their incredible staff. I have to imagine that these would be some fairly plum positions for folks who are looking to move into the nonprofit world. So once again, please maybe direct your networks and colleagues who are looking for work to the CAYL website to learn more. Just grab a pen if you can, although this will also be sent to you in the follow-up email from this webinar. But I'm just pleased to share that we're going to be offering everyone who registered for this event with a free Exchange Reflections, which is a staff development and professional development tool. And this one is focused on voting with children in mind. So given the timing of this event, we want to invite you to use that tool for conversations with your colleagues, and to get everyone in that voting frame of mind and really looking at how we can vote with children first and foremost in our minds. And then just finally, I hope it goes without saying, but we are really thrilled that you were here. And I just want to thank you on behalf of the CAYL family, the CAYL staff. Amanda has been wrangling all of us behind the scenes. We are very grateful to you, Amanda, for your fantastic facilitation. And then Valora, Brenda, and myself just want to thank you again for joining us. These webinars are an ongoing and fantastic free resource. So please not only come back, but share these with colleagues, with students, and so on, so that we can keep these resources getting out to those who hopefully will really be able to use them in impactful ways in their own communities.